Hello, and welcome to the Women in Motion series, where we'll be discussing topics on women and musculoskeletal health. Our discussion today will cover frozen shoulder and shoulder instability in women. This discussion is brought to you by the HSS Education Institute and the Women's Sports Medicine Center. I'm Polly de Mille. I'm an exercise physiologist and a registered nurse, and I'll be your host for this conversation. We'll be joined today by Dr. Michelle Q and Dr. Tiana Woolridge, who'll be sharing their expertise on this topic. Dr. Q is an orthopedic surgeon with specialized training in sports medicine, knee, and shoulder injuries. She treats a wide range of conditions using both non-operative care and advanced surgical techniques, including minimally invasive arthroscopy and open procedures. Dr. Woolridge is a sports medicine physician double board certified in pediatrics and primary care sports medicine. She offers non-surgical care for acute, chronic, and overuse injuries using techniques like ultrasound-guided treatments and PRP injections. Her patient-centered approach supports a safe return to activity for individuals of all ages. Let's start with talking about adhesive capsulitis or frozen shoulder and why it occurs. Dr. Woolridge, could you explain what frozen shoulder or adhesive capsulitis is?
Absolutely, more than happy to. So, frozen shoulder refers to a limitation in the range of motion of the shoulder that can happen over a very, very long period of time. So, there is a capsule in the shoulder joint. The shoulder joint is a ball and socket between the arm bone and the scapula, essentially. And there is a lot of looseness or instability inherently within that shoulder joint. And so there's a capsule around that that essentially helps hold the shoulder together. And in some individuals, most commonly in women 40 to 60 years old, we can see that that capsule gets thickened or tightened or scarred down, and that can lead to a limitation in the range of motion in the shoulder. Or in other words, the shoulder itself appears to be frozen in place.
And how or why does this happen?
Yeah, patients ask me that all of the time. I wish I had a better answer for why it happens. There's some randomness to it where some people have it and we don't have a great explanation for why. Occasionally, it can happen after a trauma or an injury to the shoulder. I've had several patients who have fallen and injured the humerus or the arm bone, or they had an elbow injury and they'd been in a sling for a long time. And then as they are healing from that broken bone or from being in a sling, all of a sudden they say to me, "Oh my gosh, I can't move my shoulder as much as I usually do." They try to wash their hair or they try to put on their bra strap, and they notice that they can't really rotate their arm in the same way that they used to. And that is unfortunately how this happens sometimes. And again, there are certain populations of people, certain medical conditions that increase the likelihood of developing frozen shoulder, but in some cases it's very random that some people just luck of the draw or unluck of the draw end up with this condition.
So it sounds like there's specific ages or genders that at which you would need to worry about this, maybe. And do you have certain ages or genders that you look for this in, Dr. Q?
Yeah, like Dr. Woolridge was saying, it is very common in women, usually between the ages of 40 and 60. Like she was saying, we don't really know why this population is more affected, but it is something definitely to keep in mind. If a woman comes in with shoulder pain that starts, we call it insidiously or vaguely, just out of the blue, starts to have a lot of pain, and it's usually significant amounts of pain. It's not just a little soreness. They are in a lot of pain. These patients are uncomfortable with moving the shoulder. They're uncomfortable at night when they're sleeping. And so we have a low index of suspicion to address the frozen shoulder if someone of that gender and age comes into our office. Like Dr. Woolridge mentioned, some populations are more susceptible to frozen shoulder, particularly those with thyroid disease or diabetes. So I always ask patients for their medical history, make sure that we're not dealing with that. In addition, we know that patients with diabetes have a risk of getting the other shoulder frozen as well. So we're very, very cautious in those patients to counsel them to watch out for the symptoms on the other side once the one side resolves.
And also, just to add to that, from a primary care perspective, it is a great opportunity for potential intervention. If somebody comes into a sports medicine doctor, an orthopedic doctor, and says, "Hey, I have the shoulder pain, what's going on?" And we identified this is frozen shoulder and ask them their medical history, and they say they don't know or they haven't been to a doctor in many years, that's a really great opportunity to say, "Hey, there's some basic lab work or some routine tests and exams that you should have done on a regular basis. Let's make sure that you're connected with your primary care doctor and can get those screening tests done."